think from the paediatric side, I'm a paediatrician, and we always think first about child health services and what we can do. And there's certainly more we can do around that, and we've talked around things like poverty-proofing child health services. So recognising the increase in child poverty in our country, how can we as health services mitigate some of those effects, really understand those needs and provide a better service, reduce inequalities? But we also know realistically that it's not just down to child health services. So at a minimum, we know from Dutch experience internationally that countries that focus on women's health, so focus on health during pregnancy, but also on general preconception health, so getting women as healthy as they can be, reducing smoking, increasing the proportion of women who are healthy weight, addressing mental health problems and long-term conditions, that all has a massively beneficial effect on children's outcomes when they're born. And we also know we need to look beyond the health sector. So social care has a huge impact, and we're seeing the impact of social care cuts on children. We know that increases in child poverty, problems with housing, increased proportion of children who are homeless or living in temporary housing, highest proportion of children and young people in food insecure households in Europe. So we know all of these things have a huge impact. Unhealthy children living in unhealthy societies, then there's only so much that health services will be able to do to address that. So from the research side, I think what we're really interested in is looking at how we can use data linkage approaches to link up primary and secondary care health data, to link up data on children and with women, but also to link up health, education, social care data and wider data sources about deprivation, around food insecurity, housing quality. And we can really get a picture of a joined up approach to tackling this and getting back to where we should be, which is trying to match the low infant mortality rates of other countries.